Hello, Namaskar. Myself Dr. Dyaneshwar.
Namaste, this is Dr. Vivek Daware.
I have done my bachelor's from Chaitanya Medical in Pune. Then I did my master's in sports and musculoskeletal physiotherapy.
After doing my degree, bachelor's, I worked with some eminent orthopedic surgeons, and then I acquired some great hands-on skills of physiotherapy field. We thought of having some additional instrument so that patient will get benefited, and we got exposed to this great field of chiropractic. We did our diploma in Master of Chiropractic from Sweden, Stockholm, and we are very fortunate to have get trained from the trainers from Sweden. We applied those skills on the patients and we got great results. But we were different, we know our approach is different. So with the holistic approach we started the patients, and the patients really appreciated it.
We have been working in the field of physiotherapy since last 19 years, and in the last 19 years we have successfully treated more than 10,000 patients. But in 2018 we felt that we should start something unique and something that will be beneficial for community, and keeping that in our vision, we started Nexus Physio Concepts. It's a state-of-art physiotherapy clinic, and now we have two branches. One is in Baner, one is in Pimple Saudagar.
Try to give patients a very customized, diversified thing. It depends upon, not a single thing is fitted for one patient, for every patient. So we assess that patient, we design a customized protocol for that patient, and like with chiropractic, TKR therapy, shockwave therapy, and matrix therapy, ZRT Matrix. We are having a great German technology, ZRT Matrix therapy, and of course the most important exercises. See, chiropractic, what it does, chiropractic is, it sets the bones, joints onto the place. I am telling it in a layman language. So when the bone subluxates, like when the bone moves from its place, so the muscle doesn't work properly. And if we set it on the place, then the muscle needs to work. So our speciality is again the blend. We blend everything. So as to treat the patient.
We have a state-of-art machines like TKR therapy as well as matrix therapy. TKR therapy basically is a Korean technology which benefits for the healing purpose, but matrix therapy is for pain relief and to reduce the tightness or spasm in muscles. So basically these are very updated version in physiotherapy, which has a upper hand in more than the generic physiotherapy.
So mainly people come to us by lower back pain, upper back pain, because of the bad posture while working. Their job is demanding, so all the stresses come on the back, spine. The people get neck pain, even some people get headache because of the neck pain, and of course shoulder pain because of the bad posture, weak shoulder muscles. So those are common types of patients which come to us.
So it is basically like when patients come to us, we evaluate them. And if they have spinal issues or any musculoskeletal issues, we can treat it with the chiropractic or physiotherapy point of view. If we find some red flags means if something is contraindicated, then we send them to another clinician for further evaluation. But as far as musculoskeletal or joint pains are related, most of the time a chiropractor or a physiotherapist can deal with those pain. But if something the chiropractor thinks that it needs further evaluation, then we send them for further evaluation like X-ray, MRI, like that. Now the result of treatment depends on many factors, like how early patient has come to us, and depending on his pain level, depending on the assessment, we design a treatment protocol. Usually in our practice, if patient gets better in 7 to 8 sessions, then it is advisable to continue the treatment for further sessions. If we don't find any relief in 5, 6, 7 sessions, then we re-evaluate them and then we suggest further treatment. But from a chiropractic point of view, usually if pain is chronic, then those patients get relief in 2 sessions only, because it's a musculoskeletal derangement in spine, or we can say the alignment issue. So in 2 sessions patients can get 50% relief, and further they can exercise and physiotherapy, they can completely get cured.
You are getting back pain, upper back pain, lower back pain, neck pain, tingling in the hands or tingling in the feet or a thigh, buttocks, and if your productivity is hampered because of your pain, joints are stiff, you are not able to move your neck, you are not able to get turned on your chair, then you should visit a chiropractor or a physiotherapist. People think that chiropractic personnel will break my bones, break my joints, but a trained chiropractic methods are safe if it is given by a trained certified practitioner.
We see a lot of sport injuries. Now from a broader perspective, every sport has its own injury pattern. Like in swimmers, shoulder is more involved. In football, hip or spine is more involved. Then in football, knee gets more affected. So depending on the type of sport, we evaluate the athlete and we suggest the treatment. Like in acute non-traumatic conditions, that can be treated with chiropractic adjustments. But in chronic or where the tissue has been damaged, we need physiotherapy. So like we use machines for healing purpose, and then we do rehab. So rehab is the main course of treatment for athletes to improve their performance and to improve their quality of game.
Second, people think that cracking sound will only adjust my bones or joints. So cracking sounds are okay, sometimes we get, sometimes we don't get. Chiropractor knows what is to be done. Cracking sounds are not that important. Third, people think chiropractic is a magic. If like I go to a chiropractor, I'm having chronic backache since 2 years, and if I go to him in just a session, he will crack my bones and I'll get all right. It is not like that. You should set the joint onto the place, correct the biomechanics by a physiotherapist, and then you will be all right. Give it some time. We are there to help you.
For sciatica patients, chiropractic treatment can be very beneficial. In fact, in few patients we have seen that after first adjustment only they have got very much relief, and depending on the level of sciatica, patients can be adjusted with the chiropractic adjustment. Sciatica basically it is an entrapment of nerve between your vertebrae. So assessment and treatment like chiropractic adjustment, patients can get benefit. There are many people who gets neck pain or back pain and they think that it will go away on its own in 2-3 days. They apply some ointment or take hot water fermentation. If that pain is not subsiding, that means there is something wrong. You need to visit a chiropractor or physiotherapist. With proper evaluation, that patient should be or should get treatment. If you ignore that pain, in few days that pain subsides. But pain has subsided, that doesn't mean you have improved. That pain gets compensated somewhere else in the body, and next time you get more intense pain at somewhere else or some other joint. And because in our human body everything is linked, one joint is linked to other, and that's why that pain can compensate to other joint and you can get more intense pain. So never ignore your musculoskeletal or joint pain.
See, by looking at Instagram and Facebook and those reels nowadays, people, they think chiropractic is all about cracking sound. So the cracking is okay, but that doesn't indicate the bone is on the place or the joint is onto the place. So it is all about the knowledge of the chiropractor to set the joint onto the place. High velocity slow impulse is also enough to put the joint onto the place. So cracking sound is a myth. We not always get that sound.
Nowadays, prolonged sitting, that means sitting at one place, is one of the leading cause for musculoskeletal issues. Nowadays, work style has become such that we sit at one place for longer time. Second is improper posture. That means we sit like what body feels comfortable, but that is not correct. We should sit correct. We should sit or we should do our work in ergonomically designed workstation. Third one is lack of exercise, so a sedentary lifestyle, because if we are working continuously at one place, our body is not moving, and that can affect your overall health.
Second, people think that cracking sound will only adjust my bones or joints. So cracking sounds are okay, sometimes we get, sometimes we don't get, but chiropractor knows what is to be done. Cracking sounds are not that important. Third, people think chiropractic is a magic. I go to a chiropractor, I'm having chronic backache since 2 years, and if I go to him in just a session, he will crack my bones and I'll get all right. It is not like that. You should set the joint onto the place, correct the biomechanics by a physiotherapist, and then you will be all right. Give it some time. We are there to help you.
Because our lifestyle has changed, our job style has changed, and physiotherapy has a very important role in everybody's life, from a child to old people, because everyone has a different postural issues or different orthopedic issues, and we deal with those issues precisely.
आप नेक्सस में आए तो नेक्सस में आपको थोरोली असेस करके कायरोप्रैक्टिक और फिजियोथेरेपी का ऐसा ब्लेंड मिलेगा कि जो आपको 10-12 दिन में सिग्निफिकेंट रिलीफ देके देगा. सो दिस गिव अपर हैंड टू अस बिकॉज वी हैव यूनिक फैसिलिटीज एंड आर स्किल्स that is definitely good for the patient. Some patients, they come up with having tennis elbow or plantar fasciitis. So we treat the root cause, we give them the exercises along with some modalities. That is our specialty.
So basically we correct the biomechanics. Where the movement is going wrong or certain muscles are firing in a wrong way, that should be the main treatment, correcting the biomechanics.
Visit us at Nexus Physio Concepts and get your first consultation free. Offer valid for limited time period.